Hi there, and welcome to the channel. I'm Dr. Jennifer, and today we're going to talk about a topic that brings up a lot of curiosity, anxiety, and unfortunately a lot of misinformation. What is the normal penis size? And even more importantly, how do you accurately measure both length and girth? With the rise in male genital cosmetic procedures, this question has become more and more common in doctors' offices, online forums, and social media. But before we go any further, Dr. Jennifer wants to start by reassuring you with something that might actually surprise you. Around 95% of men who worry about the size of their penis are actually within the medically normal range. Yes, you heard that right. In most cases, we're not talking about a physical issue, but rather a distorted body image. A lot of men perceive their size as inadequate due to unrealistic comparisons, especially with what's portrayed in adult films or online, where exaggerated or even digitally altered bodies are often shown. What's also fascinating is that this concern is far more common among men than women. While about 55% of men report feeling anxious or dissatisfied about their penis size, only 5 to 10% of women say they consider it a very important factor in a partner. So, take a deep breath. Dr. Jennifer S. goal here is to educate, inform, and most of all, put your mind at ease. In this video, Dr. Jennifer will share real scientific data, explain how to properly measure both length and girth, go over the procedures that exist for enhancement and their risks, and we'll even look at a historical curiosity that might just shift the way you think about the topic entirely. Let's start by learning how penis size is measured correctly. Now let's talk about how penis size is actually measured, because this part is essential for understanding what's considered normal. There are two main dimensions to consider: length and girth, which is the circumference or thickness of the shaft. How to measure length. Penis length can be measured either when erect or when flaccid and stretched. Both methods are used in scientific research, but the most consistent and clinically reliable method is the flaccid stretched length, which closely correlates with erect length. To measure correctly, use a ruler or measuring tape. Place it at the pubic bone, right where the penis meets the body. You may need to gently press into the fat pad to reach the bone. Stretch the penis out, not forcefully but firmly while flaccid, and measure to the tip of the glans, the head. The same process applies when erect. Start at the pubic bone and measure to the tip, keeping the ruler on top aligned with the shaft. It's important to avoid measuring from the skin or from underneath, as this adds extra length and leads to inaccurate numbers. How to measure girth, circumference. Girth is just as important as length and can vary significantly between individuals. To measure, take a soft measuring tape or even a piece of string. Wrap it around the midshaft of the penis, neither too close to the base nor the tip. Record the number where it meets. You can do this measurement both flaccid and erect for comparison, but in most studies, erect girth is the standard. Many men tend to overestimate or underestimate their size due to poor measurement methods, or by comparing themselves in non-erect states to others in fully erect states, which creates unrealistic expectations. Now that we know how to measure penis size correctly, let's take a look at what the science actually says. A large-scale meta-analysis conducted with data from nearly 15,000 men worldwide showed that about 90 to 95% of men fall within the following range: length between 10 and 16 cm. That's roughly 4 to 6.3 inches. The global average length is around 13.2 cm, just over 5 inches. A micropenis is defined as an erect or stretched length of less than 7.5 centimeters, about 3 inches. A macropenis, which is very rare, is usually considered above 24 centimeters, over 9.5 inches. These cases are statistical outliers and represent only a tiny fraction of the population. Average girth, flaccid stretched girth between 8 and 10.5 centimeters, with an average of 9.5 centimeters. Erect girth between 10 and 13 centimeters, with an average of 11.5 centimeters. If you're within these ranges, you're in the vast majority, and even if you're outside the curve, that does not define your health, desirability, or masculinity. Before moving on, Dr. Jennifer wants to quickly share something important. If you felt frustrated about performance, stamina, or firmness, you should know you're not alone. There is a 100% natural solution that has been helping thousands of men restore firmness and confidence without pills or injections. It's a simple 7-second technique you can do at home that supports what scientists describe as a key molecule involved in blood flow and arousal. If you're curious, just point your phone's camera at the QR code on the screen or click the pinned comment below to watch the short presentation explaining how it works. Now, let's talk about penile enhancement procedures. Girth enhancement is one of the more common cosmetic procedures. Hyaluronic acid injections can temporarily increase girth by 2 to 3 cm. The effect typically lasts 12 to 18 months. However, non-absorbable fillers such as PMMA or industrial silicone can cause serious complications including chronic inflammation, nodules, and permanent damage. These are not recommended by reputable medical organizations. When it comes to lengthening, options are limited and riskier. Liposuction of the pubic area can make more of the shaft visible but does not actually increase length. Suspensory ligament release may add 2 to 2.5 cm in flaccid appearance but does not increase erect length and may lead to instability or scar tissue. There are no permanently approved methods for true penile lengthening endorsed by major medical bodies. Penile implants are medical devices used for erectile dysfunction and are not designed for cosmetic size enhancement. To wrap things up, Dr. Jennifer wants to leave you with a fascinating historical perspective. In ancient Greek culture, the ideal male body was actually portrayed with a smaller penis, seen as a sign of wisdom and self-control. Larger ones were associated with lack of discipline or comic exaggeration, especially in depictions of mythological figures like Priapus. Cultural ideals change over time. What is considered ideal in one era can be the opposite in another. Much of today's anxiety is rooted in social influence, not biology. At the end of the day, penis size does not define your worth, your ability to please a partner, or your masculinity. What truly matters is confidence, respect, communication, and health. If you found this content helpful, don't forget to like the video, subscribe to the channel, and turn on notifications so you don't miss more science-based, judgment-free content. Thank you so much for watching. Dr. Jennifer L. will see you in the next video.